Hey, good evening and welcome everyone. Hey, good evening and welcome everyone. All right. Okay, good evening and welcome everyone to Frontline Dispatches on Organizing Upgrade, a show dedicated to spotlighting the most urgent left organizing and activism happening around the country. To Frontline Dispatches on Organizing Upgrade, a show dedicated to spotlighting the most urgent left organizing and activism. Okay, folks, excuse our technical glitches. I think we've got it corrected now. Okay, folks, excuse our technical glitches. Okay. All right. Thank you for your patience. Okay, again, welcome to Frontline Dispatches on Organizing Upgrade, a show dedicated to spotlighting the most urgent left organizing and activism happening around the country and beyond for racial and economic justice and much more. Please stay tuned for future episodes of Frontline Dispatches every Wednesday at 7 p.m. Eastern, that's 6 p.m. Central, 4 p.m. Pacific. My name is Montague Simmons. I'll be tonight's host. If you're watching on Facebook or YouTube, please leave comments in the chats. We'll be monitoring those as the show goes on. And if you haven't yet, give Organizing Upgrade a like and subscribe to the channel. And finally, to stay up to speed with all the amazing content coming out of Organizing Upgrade, sign up at our website, organizingupgrade.com, to hear about upcoming events, videos, articles, left strategy for organizers. And that's it. Let's get into it. Tonight, my guest is Brittany Farrell, coming to you live from St. Louis, Missouri, where she serves as a co-chair of Jamaa Birth Village, St. Louis's first and only Black-owned and operated midwifery clinic, and is a volunteer with Action St. Louis. Brittany sits on a number of steering committees, including the Birth Includes Us study, a multidisciplinary community-centered project exploring the experience of care for LGBTQ individuals and family during pregnancy and birth, and also works as a policy associate for Black Futures Lab and Black to the Future Action Fund. Currently, Brittany is working on her first documentary short film titled "You Lucky You Got a Mama," exploring the realities of what it's like to be Black and pregnant in America. Welcome, Brittany.
Hey, Montague. Thank you. Thank you for having me this evening.
Well, thanks for joining us. So most of our audience may know you in regard to your organizing work during the Ferguson uprisings. Some folks may have actually seen you in the Who Streets documentary. A lot of times when we get into conversations, we don't normally start focusing our conversation with the person we're interviewing. But in this case, it actually feels right to take some space for you to maybe share your arc of transformation with us, like how you went from Frontline Ferguson at the time, Ian in nursing school, to now doing work on Black maternal health.
Yeah. I think, I think my arc and my transformation of how I got from, front lines on the ground in Ferguson to becoming a birth worker and someone who really cares about Black pregnant people and Black birth outcomes is really interesting. I was called to Ferguson after the murder of Michael Brown, after a Black woman lost her son. And at the time, I was still finding what in terms of my career, still trying to figure out what it is that I was passionate about. It just so happened that during the same time that Michael Brown was murdered, and I was in my senior year of undergrad nursing school, I was also going through my obstetric rotation. And it was something about caring for, even as a student, providing care for and assisting in the care of Black pregnant women, and then I had this just this deep sadness and grief, knowing that on my off time, I was in the streets because of Michael Brown and this Black woman who lost her son. Life has a funny way of bringing things together for you. But I think that somewhere in my commitment to the work, to the movement, and to Ferguson and St. Louis, I began to think about, how our children's lives, the lives of someone's son like Michael Brown, the lives of my own daughter, are under constant attack and under constant threat by the state. And because I have a passion for healing and wellness of Black people, I found my way into birth work, because I think giving birth to Black babies, I think helping to usher Black life into this world, despite all the odds against us, is really sacred. And I just felt really grounded in doing that work as an organizer and as a young new nurse.
That's right. Can you talk to us a bit about, honestly, the state of Black maternity and Black maternal mortality? I was surprised, some years ago, when I first heard you begin to talk about it and read some of the conversations. Yeah.
I at first, when I entered the field as a registered nurse, I did not know all of what I know now. I learned about the experiences that we as Black women have in obstetric care through witnessing the experiences that my Black patients had when I was at their bedside, the experiences that they had with their doctors and other clinical staff. And I remember when I first experienced my first maternal death, I began to do the work of figuring out what is this here? What exists that is causing the amount of disparity that I saw. So I just went head into researching the experiences of Black pregnant people in this country. That's when I learned that Black women are 3 to 4 times more likely to die from childbirth related complications. And that's when I first learned that even when you control for socioeconomic status and education, we still die at disproportionate rates, compared to a white woman with an 8th grade level education. A Black woman with a college degree is still 3 to 4 times more likely to die from pregnancy, and I think something that, when I talk about maternal mortality, I tend to focus so much on the issues that Black women experience. It also impacts our babies, right? Our babies die at 2 to 3 times the rate of white babies. And I think over the years, over the centuries, since Black grand midwives were eradicated by white medical doctors, white OB doctors, the rates of maternal mortality in this country has gotten increasingly worse for Black people, you know, and I think with the attack that Black midwives were under over the centuries after white doctors came in and criminalized Black midwives with legislative action has driven this disparity that our communities, Black women, Black pregnant people, and our babies are dying from. I know locally, Missouri ranks number 7 in the nation for the worst pregnancy, maternal mortality outcomes, and so also for our babies. And I know that on the national level, you know, you got places like New York City where Black women die at 11 times the rate of white women. You know, so it's deep, and it's systemic, and it's a real issue that I think a lot of people have begun to do. A lot of people have begun to pay a lot of attention because of the work that has been happening around this issue for so long. There have been Black women organizing around this issue for so long, and I think now we're in a place where people are beginning to pay attention. There's a lot of work to be done to close this gap and to end this disparity. And I think that there's a ton of organizations and coalitions who are making it a priority to save Black women's lives.
Okay. If you're just joining us, I'm talking with Brittany Farrell with Missouri's Jamaa Birth Center, Birth Village. She's outlining literally what feels like an ongoing war against Black women and a deep crisis around Black maternal mortality. So in the midst of this crisis, last year, COVID hits. How does that impact, and it feels like it's got to be an exacerbating factor. How did that play out from what you know?
Yeah, so, you know, prior to COVID, I know here in Missouri, the Missouri Pregnancy Associated Mortality Review Board, they determined that women whose deaths were pregnancy related, they showed evidence of undergoing social and emotional distress, right? And so now that we are dealing with the pandemic, and as you know, and other people may know, that there has been economic devastation, and there has been lives literally lost, compounding distress on top of distress, right? And so the data is not available yet, but what we do know is that in addition to the circumstances that a lot of Black families have had to face during the pandemic, and the shifts that have happened in these hospitals that have left Black women isolated without support persons sometimes, and without an advocate by their side, I expect that the data there's going to be more disparity, right? As we look at the impact that COVID had on maternal health outcomes. I think that, there was a point when we talk a lot about like doulas, right? So doulas are trained professionals that provide continuous physical, emotional, and informational support to pregnant people. And doulas, community-based doulas, what they do is they stand between the patient and the exploitation, exclusion, and discrimination, and the loss of autonomy that Black women and Black pregnant people oftentimes face when they are receiving care in a medicalized birth system. So during COVID, when you eliminate a pregnant person's doula, pregnant persons, or sometimes doula people's family members are their doulas. When you eliminate their family and you make it impossible for them to have people to show up and to support them in ways that are necessary for them to be able to feel comfortable, for them to sometimes survive their pregnancy. It has grave impacts on birth outcomes. It has grave impacts on the chance of the outcomes of that delivering person, that mother's pregnancy and birth.
To our audience, thank you for joining us. You are on Frontline Dispatches, product of Organizing Upgrade. If you're joining us via Facebook or YouTube, please plug in the chat. Add your questions, comments, things that you want to know. Tonight, we're talking to Brittany Farrell of Jamaa Birth Center, or Birth Village. I'm sorry, it still takes me like back to think about like one, how bad it was, but then also how much worse COVID made it. At the same time, I'm also inspired because honestly, like Black women tend to be saving us every day, and in this case, Black women had to save themselves. Can you talk to us about like one, the work of Jamaa Birth Village, and maybe even like who else is doing this work at this point?
Yeah, I'm happy to. I think St. Louis is very, very fortunate to have Jamaa Birth Village, founded in 2015 by Brittany Kelman. It started with just meetings in her living room in Ferguson, right? And in 2020, on Juneteenth, actually, last Juneteenth, we opened the first equal access midwifery clinic in Ferguson. And I think that there's something really powerful about this Black-led midwifery clinic who is prioritizing the lives of Black women, Black pregnant people, and our babies in the epicenter of a movement, right? That has completely transformed the way that we talk about dignity and power for our communities to be able to survive, like dead in the center of the epicenter. And I know just on a personal level, when I talked earlier about how, work in Ferguson, in the epicenter, and my deep love and commitment to the healness and wellness of Black people kind of coming together in that same place, being able to serve with Jamaa in the community is super, super important. And I'm super proud of the work that Jamaa is continuing to do. Jamaa Birth Village, along with Generate Health and St. Louis Doula of Color Collective, launched the St. Louis Doula 360 initiative. So we received a $1 million grant from Merck for Mothers and Yellow Chair Foundation. And with that money, we're going to be scaling up the local doula movement by training and ensuring the long-term capacity for doulas so that every Black birthing person in the city who wants a doula can have one. This is a long sought after dream of that True had when she gave birth to Jamaa Birth Village, but also that myself, the rest of our board, and the people who we are in community with who really deeply care about these issues and how they're impacting Black women and Black pregnant people. It's a sought after dream to restructure the maternal care landscape in this city and to be able to center the needs of Black women the way that we are getting ready to do in this particular program, which is just a continuation of how Jamaa Birth Village has been centering the needs of Black women since 2015.
Wow. Can you tell folks, one, how they can actually support Jamaa, especially like other people of color and Black folks, how they can actually begin to plug in and just the efforts that are working to safeguard Black life around pregnancy and birth?
Yeah, I think, number one, I always I advocate very strongly for people to support Jamaa Birth Village through donating to the village. Jamaa offers a lot of different services in addition to midwifery care and connecting clients with doulas, setting them up with doula care. We also have mother groups that people can attend. There's an apothecary at the birth village that people are able to utilize. There's chiropractic care. We address mental health at the village. It's a lot of really important work that's happening at the village that people can support through donating directly to Jamaa Birth Village. You can go to the website, jamaabirthvillage.org, to both check out the services that we offer and to also donate and support the work that we are doing in the city. You can also spread the word about the St. Louis 360 Doula initiative, because this is really big. You know, we're going to be training doulas every month over the next 2 years, and we want to make sure it's really important to us to make sure that the collective of doulas that we train is actually reflective of our community. So that means we want to train Black cis women, Black, queer and trans folks. We want to train Black men, Black fathers. We want to make sure we are bringing in Indigenous folks. We want to make sure that the doulas that we are training and that are going to be available in this city to serve the people who need them most are reflective of the folks who are in most need.
Okay. So who else is helping drive this conversation? Like, who should folks be looking to get updates around what's actually happening specifically with Black women and Black mortality?
Yeah. I think on a national level, when I first began my journey into doing this work as first a nurse who specialized in OB care, but then also as an organizer and an activist around reproductive justice, my first organization that I fell just deeply into, just in love with their work, is Sister Song in Atlanta. And I think that they're doing incredible work. You have Sister Love. They're doing work around reproductive justice as well. I think you have Ancient Song in New York. You have, there are so many. Black Mamas Matter Collective, or Black Mamas Matter Alliance, I'm sorry, which is like a national organization made up of different partners and groups who prioritize and are delivering in this work around Black women and our babies. So there's plenty of ways in which you can plug in to the work that's being done. I know, I think Black Maternal Health Week is coming up pretty soon, and you might want to tap into Black Mama Matter Alliance as they are developing what that's going to look like for folks. Is something that you don't want to miss. I'm also, in addition to the work that I'm doing with Jamaa, I am working on a documentary called You Lucky You Got a Mama. And that documentary, what it is, it's telling the stories of Black pregnant women and Black pregnant people. I know over the summer, last summer, there were 2 or 3 deaths that I remember, crossing my feed. One person I know personally was impacted by one of these maternal deaths. I know Sha'Asia Washington and Amber Isaac. Those are 2 Black women who died after giving birth in New York City. And what I noticed in those 2 deaths, the same thing that inspired me to create You Lucky You Got a Mama is that we learn about these women's lives and the fears that they had and the concerns that they had about their pregnancy and their birth after they have died, right? And You Lucky You Got a Mama, I wanted to be able to tell the stories of Black pregnant people while they live. I want to be able to explore the lives of Black pregnant people and how we navigate the medicalized health system when it comes to childbirth. I want to explore Black people's experience with alternatives to hospital births. I want people to really be able to see that Black folks, we oftentimes are blamed for our own demise, especially when it comes to birth and pregnancy. It's either, you're too fat, you're out of shape, poor diet, you smoke, you're undereducated, you don't have healthcare. Like all of these things, we tend to get blamed for our own demise by a number of different reasons. We all know, like I said in the beginning of this call, even controlling for socioeconomic status, we still are dying at disproportionate rates. So I think wanting to kind of to counter that, right, by giving people this intimate and inside look into the lives of Black people's pregnancies and births. And it's not so much so Black folks who are to blame, right? And you, like You Got a Mama, you see Black people surviving, you see Black people thriving, you see people who love these people, you see people who they laugh with, people who they cry with, people who care for them, right? And then what you also see is how the onus is on the system. The onus is on the machine, the deep systemic racism that is killing us. And when we enter these hospitals to give birth, when we look at the curriculum and the training that clinicians are receiving before they graduate and enter into this system to provide care to Black people and our bodies and our babies, and we're looking at how even around us, right? So when you think about reproductive justice and you think about how economic injustice and environmental injustice and prison industrial complex and the deep chronic stressors, because of all of those things and more, are impacting the way that Black people, the data that you see now, right? The rates in which we're dying disproportionately. So I want to make sure that in this film, people see what the enemy actually is, right? It's not what the enemy actually is, while also seeing Black folks for all that we are, And I think that there's something really special about being trusted to tell these stories and being able to tell these stories in a way in which I want Black people to feel seen. I want Black people to feel cared for, and I want Black people to feel heard in terms of how their experiences to do something that is their birthright, to start a family and to have a birth, are oftentimes riddled with challenges and experiences that leave them dying earlier and leaves our babies being taken away from us sooner.
Thank you. So to our audience, if you enjoyed this conversation, stay up to speed with all the amazing content that's coming out of Organizing Upgrade. Take a minute, actually visit the website, sign up, hear about upcoming events, videos, etc. But also tonight, look out for our movement family at the Frontline. It's a project of Movement for Black Lives, Electoral Justice Project, the Working Families Party, and United We Dream. Tonight live at 7 Central, 8 Eastern. They're going to do a discussion. This is time for Congress to walk it like they talk it, and we can ensure that they do by demanding public accountability once and for all. Join them on the Frontline on Facebook or the Frontline's website. Brittany Farrell, thank you for making time to have a conversation, especially in the midst of everything that we're navigating in this moment. Is there anything that you actually would point people to do in terms of an action in this moment?
I want people to support the work of Black women. I want people to give to Jamaa Birth Village, give to other Black birth organizations that's in their area to support this very sacred and important work. I want people to lift up these issues more. I want people to be in conversation around how Black women are impacted by maternal mortality. And then I also want us to challenge ourselves in how we talk about birth and who who is able to give birth, shifting the culture and how we see gender in birth, right? Black pregnant people across the gender spectrum, and really honoring just the birth giving process for all folks, and understanding that, what impacts Black women when it comes to childbirth are oftentimes experienced by people who have other gender identities that are oftentimes left out of those conversations. So challenging yourself to think broader about how you think about these issues and who they're impacting.
Brittany, thank you. And thank you to everybody who's actually willing to join the conversation. Thank you for the questions in the chat. You've been given a charge tonight. It's for the sake of our community and our movement.
Thank you, Montague, for having me.
No, glad to do it. And we will see you next week, next Wednesday, same channel, here on Organizing Upgrades, the Frontline Upgrade. Stay tuned for the Frontline that starts in roughly half an hour. Thank you.